Good morning. Thank you for being here. So as many of you know, nursing is #1 most trusted profession based on numerous surveys by many people. Yes, it is a privilege, but it also gives us a responsibility as nurses to advocate on behalf of our patients, and especially advocate on behalf of the patients whose voice is not well heard in healthcare. So today, I'm going to talk to you about the need for advocating not just for patients, but for their families, for their family caregivers. We all know that our country is aging. There's more and more older adults in our midst. And who is caring for these older adults? Doctors, nurses, social workers? To some degree, but healthcare professionals are providing a very small fraction of care. Today, in the United States, there are over 34 million husbands, wives, daughters, sons, friends who are caring for an older adult. Many of these older adults are living with complex medical illnesses, and many of these caregivers are called upon to step up and to help manage the health of their loved ones. It is a very challenging task. What we know is that more than 50% of these caregivers, so if you were to become a caregiver for an older adult today, you will have a 50% chance to be called upon to manage IVs, catheters, colostomy care, wound management in your own home on a daily basis. And what we know from our own research, that majority of the caregivers feel completely untrained and unsupported in performing these medical tasks. What we also know from our own research is that majority of these caregivers feel completely lost trying to navigate a very disjointed healthcare. So today, I want to invite you to join me and the University of Washington School of Nursing and the DeTorney Center for Healthy Aging in working towards transforming the caregiving relationships from those of stress and burden and frustration to those of success and support and caring. And before I share with you a concrete plan, I would like you to hear from caregivers themselves. So the caregiver part, you never give up. And we cannot give up on our caregivers. As a clinician, I can tell you that the voices of caregivers are very faintly heard in healthcare, because I cannot bill for my time working with the caregiver and for my services, and because I don't know what are the right questions to ask caregivers so I can best help them. The voices of caregivers of color are heard even less in healthcare, especially of those caregivers who come from less advantageous social economic backgrounds. Today, I ask you to join us to change this. We are starting to form a University of Washington Caregiving Action Collaborative. This collaborative will bring together the brightest mind in research, clinical care, healthcare administration, and most importantly, caregivers themselves. Your $6,000 would allow us to start bringing caregivers to the forefront and at the center of healthcare. We will host several informal gatherings where we will learn from caregivers' challenges. We will reach out to caregivers from disadvantaged backgrounds, and we would learn what is their vision of transforming healthcare. We will then facilitate their communication with clinicians, healthcare administrators, and researchers, and come up with a plan for changing the healthcare for caregivers. And the deliverable would be a very comprehensive booklet, Caregiver's Guide to Healthcare. This booklet would be a one-stop shop where a caregiver could keep track of all their loved ones' medications, healthcare conditions, will be able to take an ongoing self-assessment of what knowledge and skills they need to manage their loved ones' health conditions, and have very helpful tips on communicating with healthcare providers. My research team and I have been working on developing all these materials for the last 5 years. What we need to do right now is to really bring in a mass power of stakeholders to help us test putting together this toolkit for caregivers, to really infuse it with the language of caregivers themselves, and to start this pilot project that would be disseminated. The big vision is that every caregiver caring for a loved one who is helping them to manage their medical conditions, who is helping them and goes to medical appointments and does all these tasks, will have a guide on how to advocate for themselves in healthcare. Thank you.
Wonderful.